Hello everybody and welcome to today's ChemCareers webinar, which is about careers in toxicology. We've got a really cool panel lined up for you today to talk all about different careers in chemistry. But to start off with myself, my name is Sarah Salter and I'm one of the in-house career and professional development advisors here at the Royal Society of Chemistry, and I'll kind of be chairing the session today. Put a couple of learning outcomes up on the screen as well, which hopefully all of you can see. But we're just going to talk about different career opportunities and challenges within this field, day-to-day responsibilities, what skills are important, if there's any particular qualifications or experience that you need, and of course any tips and advice and resources for starting a career in chemistry or kind of moving into that field. So I'm going to move on to our panelists now and just ask them to briefly introduce themselves. So Alex, does that come to you first as you're first on the screen?
Thanks very much. Hi, I'm Alex Lawson. I'm a consultant clinical scientist and forensic toxicologist, and I work at the University Hospitals Birmingham NHS Foundation Trust. I'm also the clinical service lead for biochemistry, immunology and toxicology across Birmingham.
Perfect. Thanks, Alex. Kim, should we come to you next?
Thank you. Hi, everybody, and thank you for the invite today, Sarah. I'm a professor at King's College London and currently the director of King's Forensics. We noticeably have two accredited laboratories, one testing sports samples for anti-doping purposes and the other one conducting DNA analysis. So hello, everybody.
Thanks, Kim. Hassan, come to you next.
Hi, thanks for having me. My name's Hassan. I'm the manager of a team of forensic toxicologists at Analytical Services International. So my team, we don't do much analysis, but we get the results from the lab and interpret them and write forensic reports for the police and for the coroner. Our laboratory is accredited to conduct a certain type of road traffic toxicology type case. So that's me.
Excellent. And Rebecca?
Hello, I'm Rebecca Stennings. I'm a Senior Scientific Officer for Kent Scientific Services. So I work in forensic toxicology and we work with the coroner's samples in Kent, looking into unexpected deaths and the role of alcohol and drugs within those. And that does also involve the Road Traffic Act work that Hassan was talking about.
Perfect. Yeah, no, we published the road traffic accidents booklet, and it's a little that the police have to give up of those accredited labs where someone can send their samples. So it's a nice joining up of things. Perfect. So I'm just going to briefly talk a little bit about the toxicology sector, and then we'll get into the questions. But also a reminder for listeners that if you have a question for our panel that you'd like me to ask, then please pop it in the questions or the chat box, and I'll be coming to those at the end of the session. But I'll remind you throughout the discussion. So just to talk really briefly about the toxicology sector and what toxicology is, which I'm sure you're already aware of, but just definitions are always helpful. That toxicology is to help us avoid chemical injury or manage accidental exposure of humans or the environment. Toxicologists and their work combine elements of many different scientific disciplines and apply modern molecular, genetic, and analytical techniques to help us understand the harmful effects of chemicals on living organisms and the extent to which they pose a risk to the health of humans and our ecosystem. So that's from the British Toxicology Society. And there's lots of different aspects of toxicology that we'll talk about today as well, related to drug and product safety, the environment and atmosphere, food safety, and there's the Office for Food Safety Agency in the UK, pesticides and botanicals, wildlife, occupational, and then the clinical toxicology and forensics that we're going to have to talk a little bit about today as well. Toxicologists and those associated with the field work in various organisations. So that can be academic places like KIM, in universities or within the NHS, in pharmaceutical companies, in plant protection products, other industries like Unilever as an example, contract research houses, and obviously government and regulation as well. So just briefly summarising, but it's a very broad subject to say. It touches on medicine as well, and knowledge of detailed areas can be acquired, but it's important to see the wider landscape as well, and that there's a really common across the whole science interface as well. But coming back to our panel, I'm going to kind of launch into some of the questions that we have now that we're talking about different areas. So we'll start off with Kim. So could you talk a little bit about what a career in toxicology might look like, a little bit about your role and the types of roles that toxicologists do? Maybe that'd be a little bit about what you do day to day as well, and I'll come to each of the panelists in turn.
Okay, all right, thank you. So I guess careers in toxicology in universities might start off with an undergraduate degree in one of the STEM sciences, but really if you wanted a career in the university, you would require a PhD and or some postdoctoral experience. And as you've already mentioned, there's a wide range of different toxicological departments that you could start in or build your career in. I'm based in the King's Forensic arena, which looks at clinical as well as forensic samples and analytical toxicology. So my typical day is very varied, which is very nice, and it involves research, admin, and service work. So we carry out a service for UK anti-doping. My colleagues in DNA analysis carry out research for the Home Office and the MOD. So I think a scientific background is a very good place to start if you're going into toxicology, and from there I think the world is your oyster, depending upon your specialisms and where you like best to work, I think. Thank you.
No, definitely, I agree. Alex, can I come to you next for your input on that question?
Certainly. So being a toxicologist working in NHS is again has a kind of interesting route to get there. There are different grades of staff working in laboratories in the NHS. They typically are biomedical scientists and clinical scientists. So a biomedical scientist to get there would do a degree at university in biomedical science, and then would work in the laboratory to become state registered, and then they would apply to a job in a tox laboratory, and they can work then to develop the skills they need to be like a laboratory-based toxicologist. Clinical scientists typically have a degree in something, chemistry, biochemistry, and then they apply to a postgraduate training program, which is typically in biochemistry rather than toxicology. But then they specialize after the event into toxicology, which is what I did. So I became a toxicologist after being a biochemist. My lights just turned out, so now I look like I'm sitting in the dark. So I'm just going to turn my light back on. My role in the laboratory I work in, similar to Kim, is very varied. So it will be some post-mortem toxicology we work on. We're not a forensic laboratory, but we do work with the coroner. So I'll be liaising with the coroner about cases, trying to plan the service, see what we're going to do next, bring in new technologies, bring in new techniques, do some research. So this morning I was working with a research fellow to look at some inhaled steroids and how we can detect those to improve medication adherence. And yes, there is some very boring admin. We've got our accreditation to make sure our laboratory is up to speed in a month's time. So a lot of time is taken with some admin and quality workload, but it is pretty varied, and it is an enjoyable job. We do work with doctors, nurses to manage patients and help them get better. So it is a very worthwhile and enjoyable job.
No, that's great. Thank you. And so much detail around the different routes into NHS and being a biomedical scientist or a clinical scientist. That's really useful. Hassan, can I come to you next?
Yeah, sure. So in forensic toxicology, there's typically two routes that someone can take. There's the analytical route where you're doing extractions and assays of samples from forensic cases where toxicology may play a factor. So you'll be the one doing the analysis, processing the data, and eventually checking the data, doing instrument maintenance and that sort of thing. The other route, which is the route I took, is to become a reporting officer. So that is interpretation of the results based on the case and giving evidence in court. Now, it sounds pretty scary, but there's a lot of training involved before you can give evidence in court. And part of my job is to train trainee toxicologists who have they have about a year or two's experience before getting into forensic toxicology in a lab doing analytical chemistry. It doesn't have to be toxicology, but that's the sort of thing I looked for when selecting my trainees, whether they have a relevant background. When it comes to giving evidence, there's certain cases that we tend to go to court on more than others. For example, for the coroner, I rarely go to inquest, maybe 2, 3 a year. Whereas for road traffic acts, I'm in court about twice a week. So yeah, that's in a nutshell, that's a route into toxicology and the two different forensic toxicology pathways that there are.
Mm-hmm. Yeah, that sounds really interesting and varied, and definitely going into court. That sounds really that sounds scary to me. Standing up in front of people. I was wondering, is that an aspect of your job that you enjoy? Is that?
Yeah, so to me, going to court makes it tangible. What we're doing is not just a case. It's not just a name on a piece of paper on the front of a case file. It makes it real to me. Which is what I like about it. But I mean, a lot of the time we're in court and we do give evidence, but some of the time it's just a lot of waiting around and getting told that the defendant's pled guilty or whatever the case may be. So yeah, even though there are a lot of training, the training is also designed to make you feel confident to be in that sort of environment.
Yeah, definitely. I imagine, this sounds like a lot of waiting around as well. Thank you so much for that. And Rebecca?
Okay, so quite a few similarities to Hassan and how our team works, but we're quite a small team here at Kent Scientific Services. So we do work for Kent County Council. So obviously, everything coming from Kent and a little bit from surrounding areas. So there's 6 of us on our team. And as it works, we all take part in analytical work in the lab, performing extractions and receiving samples and working the accreditation work as well. But as you grow through the team and you develop, the senior scientists report to the coroner. So I'm up at that level now for the past couple of years, and I have performed as an expert witness in court, same as Suzanne. And yes, it is a lot of waiting around, and it can be quite intimidating. But like you said, it does make it very real, and I really love the real life difference the work makes every time you do a report, really. So yeah, I find that quite satisfying. Oh, and we come from quite different directions from our team of 6. So some of us came with degrees. I personally came with a biochemistry degree. And previously worked in pharmaceuticals before I headed over to this. So I didn't come necessarily with exactly toxicology experience, but developed within the team has had a lot of relevant skills. And we've got a couple of apprentices working with us, so they're getting their degrees while they work. So yeah, that's been quite good for everyone.
Yeah, it sounds like quite a diverse team, and definitely the excuse me, the apprentices as well, and kind of, you said, moving up your career, and you had different experience in the past as well, and you've kind of been able to make that change. I know when I speak to members, they're always looking to, how do I move into a different sector, or how do I change into a different role? So it's really great to see that you've done that, and it's a great example, because there'll be people today, I'm sure, who are interested in switching across to more of a toxicology related career as well. But that sounds great. So we've covered some of these already, but I was wondering, what does the industry offer kind of graduates or experienced chemistry using professionals? And maybe, like Rebecca, if you do have apprentices, maybe that might be something you could touch on as well. Hassan, could I start with you?
Yeah, so as a graduate, you could either, if you've got a relevant graduate degree, so something like chemistry or forensic science or something like that, the best place to start is in the laboratory as an analyst. I would suggest that's the best way to start. I did mention that we do have a trainee program for reporting toxicologists, so people who go to court and things like that. But I don't think I think having the analytical background to start with definitely helps with that. And as I said, that's what I looked for when selecting my current trainees. I think it helps. It gives you a bit of a good bit of knowledge. A lot of the time in court, you're not just talking about toxicology, you're talking about analytical chemistry as well. So you do need to know about that.
Yeah. Is that background, is that specifically a qualification, or maybe if someone's got some experience, a couple of years in analytical chemistry?
Yeah, some experience with sort of analytical chemistry, maybe some bench techniques, doing extractions or working with instruments.
Okay. Yeah, I just think when you said what stands out for you, I think like that's the kind of information
Yeah.
people will be interested in. So that's good to know. It's both of that experience as well.
Yeah.
Rebecca, can I come to you next about what the industry offers, and maybe you can talk a little bit about the apprentices as well, because I know that's a really valuable route as well, and something that the RSE is always promoting.
Yeah, well, obviously it was very attractive to me. I was very keen to go to toxicology when I heard of the opportunity available. And yeah, it certainly wasn't a barrier, the fact that I didn't come from necessarily toxicology background, and the fact that I did have all those analytical years experience. So yeah, I definitely, like Sam, would definitely promote lab work first. And as part of my degree, I did a placement year. And I think that was extremely valuable in getting me in any job kind of anywhere in a lab. And that was a good place to build up from for me. But yeah, our apprenticeships, we've taken some of them straight from school. And really the key thing was that they had just a really keen interest in science and the willingness to learn and develop with us. So yeah, we've got a couple of apprenticeships right now, one doing pharmaceutical sciences and the others just finished his chemistry degree with us. So yeah, they're very valuable members of the team doing it that way. We like having them for that length of time. And yeah, then they can build up to being reported officers as well, hopefully, eventually.
That's great. What was it that kind of attracted you about this field, coming from pharmaceuticals?
Gosh, if I'm honest, probably a lot of TV shows growing up that really fueled my interest in science anyway. So yeah, watching Bones and everything, can't lie, that did nurture an interest quite early on. But yeah, once again, it's the real world interest really, because before that I was part of stability teams in pharmaceuticals, which is a bit dry, working for expiry dates and stuff. Going towards that, which obviously was making an impact, but not the same as it is here. So yeah.
Definitely, and I can see Hassan nodding his head as well. Alex, can I come to you next? I want to specifically about, I guess, the NHS and what that offers graduates and maybe experienced professionals looking to move into the kind of toxicology field.
I think the NHS would be a frustrating place, I'd say, to someone with a lot of experience to move into. It's quite clearly governed about what people can and can't do based on their professional registration. So it can be a frustrating place if someone's got a lot of experience to move into and get into the similar sort of grade. Moving from pharmaceuticals to the NHS can be a frustrating thing where there would have to be some retraining into some sort of clinical skills. That doesn't say that can't happen. Someone who's got a degree in chemistry and some pharmaceutical background can apply to be a clinical scientist, and that is absolutely fine, and they would be a very strong candidate to do that. In regards apprentices, the NHS also does offer apprentices. We have two in our department, our toxicology department at the moment, who are training with a degree in blood sciences. So it's biochemistry, hematology, and toxicology, a bit of toxicology in there, but they are working within the toxicology department, and they've been doing that for 4 years. So there is opportunities, and it's part of the scientific pathway in the NHS was that you could go in as an apprentice and work your way up through different fields to become, a consultant biochemist. I think it's quite a lofty ambition to do that, but that is the pathway that can happen. So there are opportunities for people who have a degree in chemistry and some experience to go in as a clinical biochemist and clinical scientist and train in the clinical field. Or if you haven't got the degree yet and you want to get a degree while working, there is the opportunity to be an apprentice that can move to a biomedical scientist, that can potentially move to a clinical scientist as you train on. So there are opportunities at different places. The only problem with the NHS is there's quite a lot of accreditation, because you've got to become a HCPC registered scientist to do anything, and that takes a degree of training. But I'm sure that there's similar levels in all these different fields we're talking about. So there are opportunities for lots of different people to come into the NHS if that was what they wanted to do.
No, that's really useful. That's lots of information there. Yeah, and I didn't know about a few of those things. That's really helpful. And Kim, can I come to you as well? So what does an academic career offer? toxicologists or graduates as well?
Yeah, so I think from the point of view of the graduate, we offer as well placements and internships, and of course PhD programs in a variety of different areas that involve training in analytical techniques, research, and service. So a bit like Alexander, if you're placed in the accredited laboratory, then it's quite a rigid structure, and the work may be repetitive because we're working to standard operating procedures. But I think generally the work is very varied in that if you're dealing with cases and different testing results, then no two cases are the same. So it's attractive from that point of view. Yeah, I think education and training are what we would offer. So we've got 2 master's programs as well, one in analytical toxicology actually, and the other one in forensic science. And out of those, you can either go directly into industry, or you can go on to do further study and do a PhD. So lots of different routes in to study according to the level that you're at, and again, what your area of interest is.
That's really useful. Thank you, Kim. And just a reminder for the listeners, if you'd like to ask a question to the panel, then please pop it in the questions box and I'll get to it at the end of the kind of set questions. Perfect. So I'll come on to our next question. And Alex, if I start with you. So if you were kind of recruiting for a new member team, you've mentioned a few things mentioned a few things already. What would make that application stand out? And I don't know if there's anything you can say about the recruitment process as well.
I mean, Hassan and Rebecca have mentioned things. People who've got real experience of working in the laboratory. So when people apply, we want to know they've taken an interest. So even if they haven't had chance to do lots of these techniques, they've been to see people. They know what the career structure looks like. They know what some of the techniques you're using are, and some of the outputs, and the people in the staff. So knowing the job, knowing the environment, knowing what the job will entail, both in terms of the short term when they start, then what they look to do in the next 5 to 10 years is always really, really important. And most things we do, whichever field we're looking at, working in, is to do with that thirst for knowledge, or wanting to fix things, or change something, or and it's that inquisitive nature which really stands out, because that's what makes working in toxicology, in the NHS rather than biochemistry, more interesting. Because as Kim said, no 2 cases are the same. We're looking at urgent reports, trying to turn something around quickly. We've got to drop something and change something, being adaptable. And it is an interesting field, but it is one where you've got to be adaptable, be a bit more fluid in your approach to things, because it's not always the case that you do this, you end up with the same output. Something might change, and you've got to be a bit inventive, I suppose, with some of the things. So a knowledge of the profession, a knowledge of the career progression, a knowledge of what the actual job entails, and also that spark that someone really wants to investigate things and make things better and improve is always a real bonus for me.
No, that's lots of really valuable thing, and taking that time to speak to someone who maybe does the job and understand what that environment is like, and then they can demonstrate that in an application or when they're interviewing as well. And I liked about that inquisitive nature, and something that Rebecca's mentioned is that making that, and Hassan as well, that tangible impact as well. And that's something that comes up again and again when across all chemistry careers. That's what we see about making that actual tangible impact is so important. So it's great to hear about that. Hassan, can I come to you next with the same question about kind of recruitment and what makes someone stand out? You've touched on kind of the background and that analytical lab experience, but is there kind of anything else, maybe those transferable skills?
Yeah, so when I designed the interview for my trainees to recruit 2 trainees, I put in there that they have to do a short presentation on a drug, and it could be anything to do with the drug. And that wasn't to see how much they know, but to see how they can present themselves, because a big part of our job is to present evidence. So they just had to do it, and during the time it was COVID, so they might have had it a bit easier doing it. over the screen instead of standing in front of us in an interview room. But they had to do a short presentation. I think I said 10 minutes on that. So what I was looking for was how they present themselves and their ability to research things, because as we've all said, every case is different. You can't have two, even if the two cases are similar, there's going to be differences between them. And yeah, thinking outside the box as well. They're the sorts of things that I was looking for in the interview when I was trying to find these trainees. I wouldn't suggest applying to be a reporting forensic toxicologist unless you're comfortable standing in front of people and talking.
Yeah, no, that's very good advice.
Yeah.
And like we said about, I definitely find it easier presenting from virtually from home or wherever. Sometimes than standing in front of people. I've kind of lost that skill over the last few years as well. So hopefully I get to develop it again at some point. But that's some really insight as well. That's useful. I like thinking outside the box. That's really useful. And Kim, can I come to you next with the same question about if you're looking for placement students or people in your department, what is those things that make them stand out?
Okay, so I think a covering letter is really important when we're looking at applicants, especially if we've got large numbers of people applying for one role. So it's very important that the cover letter relates to the role, which may seem a bit silly, but sometimes they're very generic. So make sure that the covering letter is specific to the role and it covers some of the areas that will be your responsibilities in that role. And your CV should be up to date. Again, I know that might seem the obvious thing, but sometimes it doesn't seem as though they are. So making sure that everything's up to date, making sure that your covering letter demonstrates that you can you can do the job that you're applying for. Others have mentioned problem solving, motivation, organization. So all of those kind of traits need to come through in the covering letter so that you get through the process to the interview stage. And like others, it's really important that you've done a little bit of homework, you know about the organization or the place that you're going to work out. It's really important that you have looked at the job and made sure that you've got some examples of how you've done things that would have the same skills that you're being asked to do within your job. So it's really doing a little bit of groundwork to make sure that you sell your capabilities in relation to the job that you're applying for.
Yeah, absolutely. And as someone who reviews a lot of cover letters and CVs, definitely sometimes they are a bit generic and not always the most up to date. Like, where's your degree? You said you got a degree, but it doesn't appear to be on here. Or if you're currently studying a qualification, even if you're not finished, just put it on there to say like still in progress. So that's really great to highlight that. It's important to do your homework, speak to people, and make sure you're making it, tailoring it to that organization as well and what they're working on, so that they know you've done your homework. So that's really helpful. I don't know if you have a specific preferred length for a cover letter, Kim, if there's not too long, not too short, I assume.
Yes, exactly. So definitely no longer than 2 pages and ideally around the 1 page.
Mm-hmm. Yeah. And yeah, using examples as well, that's always key. Perfect. That's really helpful. Perfect. So I'll come on to the next question, and a reminder, if you've got questions for the panel, then to please put them into the question or the chat box, and I'll pick them up towards the end. So our next question for the panel is, what advice would you give to someone starting out on how to progress their career in toxicology? We've touched on a little bit this so far, but are there any resources or anything that can help someone get started in toxicology? Maybe Kim, if I can come back to you first, and then move on to Hassan next.
Well, I think these days there are lots of different resources, from webinars to short courses. There are different organizations that you can join. So I think when you're starting out in your career, if it's your chosen career, then obviously you would be motivated, you would speak to people, you would try and network, go to conferences, workshops, and just see if you can find out as much about the career that you want to pursue as possible. So I think this is where it's the individual motivation to proceed and do well that needs to come across.
Mm-hmm. Yeah, no, absolutely. And I saw Hassan, you were nodding your head there as well.
Yeah, I agree with Kim with a lot of things. I think a big one is signing up for these organizations and going to conferences, because at these places you meet a lot of people with a lot of experience in different areas of toxicology. Some of these organizations aren't too expensive to join either, which is helpful for someone who might be still a student. They are very, very helpful. I don't think I would have got to where I am in my career if I hadn't met some of the people who I have met.
Yeah, definitely. Talking to people makes such a big difference, and find out whether that kind of career, I would say to people, go and talk to someone if you're not sure, because if you do, then you'll take an interest in the conversation, it will interest you and you'll want to find out more about it. But if you just like talk to them and go, that doesn't really sound up my street, or that doesn't sound particularly interesting, then you at least know as well, and you can kind of go on to something else and explore, okay, well, what other options are there with this thing that I'm interested in?
The other thing I would suggest is use LinkedIn. And if you're interested and you in a certain career and you find someone on LinkedIn who's working in that career, just send them a message. I've received messages from students and I welcome them, because it's a resource at the end of the day. And, you know, it might save you a few years of doing something you really don't like, or maybe you'll find something you really do like just from talking to someone on there.
Exactly, absolutely. That's exactly what I suggest to people as well. Like, if you have a question, ask it. The worst thing that can happen is they don't reply, or they say no, or they say nothing. That's it, as bad as it can get. Otherwise, you can have a helpful conversation with someone, and like you're saying, just kind of figuring out whether that is for you and whether it's worth investing that time and energy and resource and having more conversations, research, looking for jobs in that area. I think that's really, really important. And I'm big advocate of LinkedIn. It's a great research tool as well. Like, how did someone get to that role? Oh, they did that job, they did that qualification, they're in those groups. It's a great research tool. So I definitely big up LinkedIn as well. Rebecca, if I come to you next with the same question. So you mentioned apprentices, but you have like a smaller team. How does that work when it comes to applications and people joining the team? What does Kent Scientific Services look for?
Mainly we're receiving CVs. I guess we're really looking for the enthusiasm of toxicology and the willingness to learn is the main thing. So like I said, we're not always looking for a degree level qualification yet, depending on the role we're looking at. But really, I suppose it's the precision, attention to detail, those sort of, and time management skills are the sort of things we'd like to see on CVs, people highlighting, because very important, like working in the lab in our sort of role. What else? I think also proves it's hard to when if you work with similar instrumentation to us, so in analytical chemistry labs, maybe not quite the same, but it is all very relatable and transferable skills. And equally, I think if they've worked under other quality management systems, so we're working with UCAS at the moment, and they're bringing a lot of new legislation recently. We've had a lot of work towards that, so if they can be helpful towards that, then it's ideal. But yeah.
That's a really good point. It's often those systems as well that can help, like, oh, I've worked with this before, and that accreditation experience. That's really useful. And I just saw a question popped up, and it's very much on this topic. So I'll just stay with this one of the questions from the delegates, and they're asking about, will you look at the CV or the cover letter first, and is there anything that gives an immediate or good impression when it comes to it? So that's a question from one of the listeners. I don't know, maybe Hassan, you want to jump in on that one?
Could you rephrase the question? So do we look at the CVs first, like before interview?
Yeah, and what kind of makes an immediate good or
Okay.
bad impression, maybe. Sometimes the bad
Um,
impressions are helpful as well.
So yeah, that's how we select people for interview, looking at CVs and cover letters if we've asked for them. The things I'd look for in a trainee reporting officer is firstly how much experience they've had and what experience, as Rebecca just said, whether they've had experience with similar instrumentation, similar accreditation schemes and things like that. And just seeing what they've done before. As a bad thing, I don't really know because I've only been through one round of interviews and everyone seemed to be pretty good. But I would have thought that a bad CV would be something that's not completely up to date, doesn't look like it's been thought through. Very generic cover letter, and yeah, just not a high level of attention to detail. I need to be able to see that someone actually cares and wants to do the job as well.
Absolutely. And I think, yeah, seeing so many cover letters and CVs that sometimes people get the name of the company that they're applying to wrong. Sometimes that
Yeah.
happens, and I'm like, that's not the right company name for the link that you've sent me, or not including like a contact phone number, or there's no contact details on the top of their CV. And like, well, how are they supposed to follow up with you? Or using your work email address to apply for jobs at different companies. I always think that's a little bit not cool. You maybe use your personal email address if you're going to be applying for jobs. Those are some things, and using evidence, like Kim touched on as well, using examples of why you think that you're a good candidate for that role, and understanding of the job. Those are the kind of the advice that we give as well. Kim, I don't know if you have anything else you'd like to add to that question.
Yeah, I think the cover letter and the CV should actually fit together. So you'll talk about in your cover letter why you're qualified and right for the job, but that should link to what you're saying in your CV as well about your qualifications or about your expertise or what you've done in your experiences. So I think they both fit together. Spelling mistakes, sloppy cover letter, lack of attention to detail, as we've heard before, and infactual information are all real big no-nos, I think. So you've got to sell yourself on in the cover letter and in your CV, and if you can't get that right, then I think it gives an impression that perhaps you aren't as organised and as good at attention to detail and problem solving as you might be trying to persuade the panel that you are. So it's really important.
Yeah, absolutely. And I definitely pick up on that attention to detail. If there's typos, if it's not well formatted, if it's got a mixture of different fonts and it doesn't really say attention to detail, and people read into that and use an excuse to any reason to kind of thin the pile. If there's a lot of candidates for a role, those kinds of things count against you. And I think touching about LinkedIn as well, like even if you don't use it, just make sure it's up to date and it matches with your CV. So if someone does Google your name or alternative search engines, then it all kind of matches together and it doesn't raise any questions. That's something that I say, even if you don't want to actively engage with it, make sure it's not working against you without you kind of being aware of it. Yeah, that's from what I see on my side of the view, and speaking to our members and delivering application advice. I don't know, Alex or Rebecca, if you have any comments or questions or any thoughts on that particular question.
I think it's been answered very nicely. The only thing I'd say is really draw on your strengths and make a point in the cover letter or any accompanying information of what sets you apart from other people. Because when you're looking at these lots and lots of applications, it can become very generic because people have the similar sorts of experiences, and it's really pulling out the thing that makes you special or you right for the job and really putting that out there, and linking those attributes with the attributes of the company or the position you're going for. That's often what stands out to me, and what people often still don't do at interview either. They don't take all that great experience they've had and really sell it to you, which I think is a really important thing, obviously with a well formatted, well spell checked cover letter and CV as well.
Yeah, Absolutely. As always, people, like, you need to sell yourself because no one else will do it for you in this situation. So it's really, really important. It's something that we see. I don't know, with scientists, they don't seem to feel comfortable with it. So like, you have to, in this situation, move a little bit outside of your comfort zone, and just use that evidence-based approach as well. And that piece about values as well in the company, it's really important. And those, not just your science and your technical skills, but those transferable skills that we've highlighted, like problem solving, attention to detail, being adaptable. Those are things that you can evidence in your work, but also maybe activities outside of work as well. Those also are relevant. Rebecca, I don't know if you had anything to jump in on there.
God, no, I think you've covered quite a lot there. But yeah, no, I must say that the spelling and the poor formatting, it does just show like a lot of lack of care, and it would put me off it's good towards the role. But yeah, it's really what you can bring to the team and what's different about you that would help us really.
Yeah. No, I think that's really, really important. We always say a fewer quality over quantity when it comes to applications. So make sure that they're really highly tailored and really highly suited for that role. And just to flag, if you are a member of the RSE, then you can contact myself, the careers team, for support with applications as well. We see lots and lots of them every week, so we can give you feedback and be that objective third party and help point out what could work better and what is working and what you could make more of as well. Perfect. So we're coming up towards the last question. So what advice would you give to someone starting out on how to progress their career in toxicology? Is there any specific experience? And I know you've already highlighted a couple of resources. So maybe Kim, we could come to you first.
Sorry, what was that question again?
Sure. It's what advice would you give to someone starting out on how to progress or start their career in toxicology?
Well, I think we've covered that quite a little bit. It's really networking, visiting conferences, workshops, taking advantages of any types of training, learning online, and really trying to find out as much about the particular area of toxicology you're interested in, and talking to people who are in that role. I think that's kind of important.
Yeah, absolutely. And Hassan, who come to you next?
Yeah, as Kim said, I think we've covered a lot of the requirements to get into toxicology. I would also suggest that if there is a particular place that you would that appeals to you, that you'd like to work, just send them an email. And you never know, they might invite you for a cup of coffee and a little chat, even if they don't have vacancies, just so they know who you are, so that when there are vacancies, you're top of the list, sort of thing, or you'll be thought about if they liked you.
Yeah, absolutely. And it's that what we were talking about earlier, that finding whether that's a good fit for you as well, and getting some experience. And you never know what someone might say or what role might come up in the future. It's always useful. Alex, did you have anything else to add?
Not really. I mean, everything has been covered, but Rebecca mentioned at the start that people often hear about toxicology from TV programs, and by talking to people and going to these networks, you'll find out that it's not like a TV program. You don't have a big machine that says match or detected when you find something interesting. So the reality can be quite different from the popular television programs, and I think that networking and visiting people will put something in perspective. You might spend a lot of time thinking you're a plumber trying to connect bits of tubing together, but that is how a lot of us start out. So it's as Kim and Hassan have outlined, there's a really good ways to find out more.
Yeah, no, it's great. A bit of a reality check, just making sure it makes sense and you're not being swayed by the lights and all of the fancy software. Rebecca, did you have anything to add there?
I said mostly covered, but yeah, I think the realities of working in a lab that you say are so different than what's in TV. So yeah, make sure that's definitely for you. I had done a week's placement experience back when I was at GCSE level working in a lab. I think that was helpful to see the reality, and then sort of building up on that as I got more skills and qualifications myself. See how I would fit and whether I would like that. But yeah, totally speaking to a lot of people, and I think I've stayed in touch with colleagues and then gone to other jobs and then seeing how they're getting on there, and you just hear more about other places and expands your knowledge on what opportunities might be out there, I suppose.
Yeah, absolutely. I'm always talking about the value of networking and just finding out information. I'm like, you're a scientist, so you have research skills, use them in this context as well. It's that can be really, really helpful. Cool. So that's the end of the kind of set questions, and there's a few questions that come through, but I'm aware of the time, so I'll just choose one or two of them, and we've kind of covered a couple of them anyway. So the first one was for you, Alex. Is there kind of a shortage of toxicologists in the NHS? Is that a role where there's a number of roles, or is there a shortage, or is that something that's actively recruiting for?
It's a slightly different field to, it's not really a shortage, because some of the work's done in big centres, so not every hospital will have a toxicology department and a toxicologist working there. It's typically the big cities will have a large hospital, like a hub hospital, which often has a toxicology centre, and not every toxicology centre is going to be the same. So not every NHS toxicology laboratory will be doing coronial work, drug quantitation. They may only be doing drugs of abuse screening or monitoring of drug for therapeutic purposes for things like immunosuppression. So it's not quite like the fields that Rebecca and Hassan are working in, where there's quite clear, they're doing lots and lots and lots of coronial work, and that's what the company's doing, or forensic work. It's quite a mixed bag, and I think that's why the training isn't quite as straightforward. It is a clinical biochemistry based training, which then you specialize in toxicology afterwards, but there's no formality with that. You can then become like a registered toxicologist, like I have, but it's a bit of a mixed bag in the NHS. I don't think there's a shortage. There's just not that many places doing it, but it's still an important role to have. And I am working with the Royal College to try and make it a bit clearer what we can do to support people who want to be a toxicologist who've had some training in another clinical area in the NHS. So not a shortage. It's just that there's not a lot of laboratories who are doing a wide breadth of analysis. There's one per big city, really.
Yeah, no, that's really useful. And there's another question that's more technical. So maybe Rebecca or Hassan or Kim. Not that you're not technical, Alex, just I'm trying to spread the questions around. And it's asking about what particular analytical techniques that you use, what are relevant or the really essential ones to be a toxicologist, or you use in your day-to-day bench work.
Well, we do quite a range. Sorry, go.
No, go ahead. You started.
Oh God. Okay, so we do quite a range of assays and extractions here. So I think there's quite a few instrumentation you could have worked with before. But we run through HPLC, GCMS, GCMPD. We have LCMS. We also run immunoassays, but UV spectrometer. So many things. Yeah, different extractions within that. We do protein precipitation. We have liquid extractions. There's a lot of techniques there.
If I could add, every lab's got slightly different instrumentation, different extractions, different techniques. So as long as you've got some relevant background in analytical chemistry, particularly with sort of chromatographic techniques and mass spectrometric techniques, I think that's a very good place to start. Even if the lab that you're looking to work in doesn't use those, you've already got a lot of the skills you need to continue in that new lab.
Yeah, that's really, really useful to point out. I think that's that transferability as well. And then I don't know if Kim, maybe this might be useful for you. There's or helpful for you to answer. Is there any institutes offering summer internships in 2022 that we know of? Or are there any places that come up regularly, or do your organisations offer them? I guess that's for any of the panelists.
Yes, I think there are always internships across the university in a wide variety of scientific, biomedical or analytical tox arenas, from 3 months to 6 months, and some are paid, some are not paid. They may be in individual research groups, they may be within a laboratory that's accredited. So yes, there are lots of different opportunities. Again, as you've heard this morning, it's reaching out to the leader of that particular group and asking if there are any opportunities, particularly if it's an area you have some experience in, and or if not, if you've got the basic background, scientific background, then reach out and see what there is. Some people may be taking on more than one person, so it just depends on the size of the group and the area that you're interested in. But yeah, there are lots of opportunities, definitely.
That's great. Yeah. And like Hassan said as well, just reaching out and asking people, you never know where that may lead to as well. So that's really great. That comes to the end of the questions from me and the questions from the delegates. So I'm just going to run through a few final slides. There's a couple of resources that I put together and that the panel suggested about how to get involved. And if you're a member of the RSE, then you can get involved with our toxicology interest group as well. They run online events. And it's that networking, conferences, that side of that we were talking to. If you're interested in maybe moving into this, or you're a graduate exploring your options, then maybe go and join some of their events, or reach out to the committee members. They're always happy to hear from people as well. There's the Faces of Toxicology job profiles on YouTube, which shows about some more different roles within toxicology as well. And the London Toxicology Group, which I think most of my speakers came through today as well. So I really appreciate that. And obviously, I think they're a great network to be involved with as well. There's the British Toxicology Society, and I linked to the NHS page on the Health Careers website, where there's all the NHS vacancies, and there's lots of really high quality careers information there as well. So definitely have a look at that. It's got information about entry requirements and the training that Alex detailed today as well. So we've had questions, but just to say about the careers team at the RSE, if you're a member, then we do provide one-to-one careers advice. That's via phone, via email, and via video conference as well. That can be on any aspect of managing your career, whether it's job searching or professional development. If you're looking to develop specific skills, or if you'd like to join our mentoring scheme, that can be really helpful. And you can find our contact details on the slide. But we're always happy to receive questions. And the best email address to get us on is careers@rsc.org. If you're not already a member of the RSE, then you can find some information on screen about signing up to being a member. We've got around 54,000 members around the world, so it's another great source of networking and connections, which we've talked about today as being really important as part of any career planning and development, and finding out what you're interested in and what motivates you. There's lots of different benefits, and you can see about them on screen. There's access to the careers team, professional recognition, see that connections part as well. So that's the end of my slides, and the end of the webinar for today. So thank you so much to Kim, Hassan, Alex, and Rebecca. This has been really, really interesting. And I know I've learned lots about the technical side of things, but also those transferable skills as well, which I'm always saying to people, those are really, really important too. They will help you stand out. So thank you for sharing your wisdom and your insights today. It's been really, really great to talk to you all. So,
Thank you.
Thank you very much.
Thank you. Thank you, everybody. Take care. Bye-bye.
Bye.
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 Bye.